Traditional Amish communities have some of the lowest cavity rates in the United States, and they are not doing anything complicated. Every morning before breakfast, a 2-ingredient rinse that costs under $2 does the work most people spend $40 a month on dental products trying to achieve. The rinse is baking soda and salt dissolved in warm water. Half a teaspoon of baking soda, a quarter teaspoon of fine salt, in a small glass of warm water. Stir until dissolved and rinse for 30 to 60 seconds before spitting out completely. Do not swallow. Do this before breakfast rather than after, and here is the specific reason why that timing matters. Overnight, the bacteria in your mouth feed on residual food particles and produce acid as a byproduct. By the time you wake up, the pH inside your mouth is more acidic than it should be, which is exactly the environment that allows cavity-causing bacteria to begin demineralizing your enamel. This is why morning breath exists, and why dentists often say the first hour after waking is one of the highest risk periods for enamel damage. Using the rinse before breakfast neutralizes that acid environment before you add food, which would otherwise extend the acidic window further. Baking soda, or sodium bicarbonate, is alkaline with a pH of around 8.3. When you rinse with it, it raises the pH of your mouth above the threshold at which enamel demineralization occurs, which sits at around 5.5. The cavity-causing bacteria that thrive in acidic conditions are disrupted when the environment shifts alkaline. This is not folk wisdom. The American Dental Association has recognized sodium bicarbonate as an effective plaque remover and pH neutralizer in oral care since at least the 1980s, and multiple clinical studies have confirmed that baking soda-based oral care reduces Streptococcus mutans, which is the primary bacteria responsible for cavities, more effectively than many standard toothpastes. Salt adds a second mechanism. Salt is a mild antiseptic that draws fluid out of bacteria through osmotic pressure, disrupting the bacterial cell wall and reducing the overall bacterial load in the mouth. This is the same reason saltwater rinses have been used for oral wounds and gum inflammation for centuries and are still recommended by dentists after tooth extractions and oral surgery today. The combination of baking soda, raising pH, and salt-reducing bacterial count addresses the two primary drivers of cavity formation simultaneously. The title says, "Dentists will not mention this," and that deserves an honest explanation rather than an unqualified conspiracy claim. Dentists are not hiding this. Most dentists know baking soda and salt rinses are effective. What does not fit inside a standard clinical appointment is telling a patient to stop buying commercial mouthwash and mix something in their kitchen instead, because clinical practice operates within what can be prescribed, tracked, and covered by insurance. The gap is structural rather than intentional. The Amish figured this out through generations of practical necessity and passed it down because it worked, not because they were trying to avoid dentists. For people who already have good oral hygiene habits, this rinse works best as the first thing you do in the morning before brushing or eating. Follow it with your normal brushing routine. For people with existing gum sensitivity or inflammation, the salt concentration can be increased slightly since higher salt concentrations have stronger anti-inflammatory effects, as confirmed by dental research on saline rinse therapy for periodontal disease. One practical note on what this rinse does not replace. It is not a substitute for brushing, which physically removes the biofilm of plaque that builds on teeth overnight regardless of pH. It is not a fluoride treatment, and people in areas without fluoridated water who are at higher cavity risk may still benefit from a fluoride supplement or fluoride toothpaste used separately. The rinse is most accurately described as a low-cost daily pH reset that creates an unfavorable environment for cavity-causing bacteria at the moment they are most active. Amish communities do not have access to fancy dental products or frequent professional cleanings in the way most Americans do. What they have is a consistent daily practice refined over generations to address the actual root cause of most dental decay, which is not the absence of an expensive product, but the presence of an acidic oral environment that nobody taught most people to manage. Make this rinse tonight with what you already have in your kitchen, use it tomorrow morning before breakfast, and notice how your mouth feels compared to a normal morning. The clean is different from what commercial mouthwash leaves behind because you are changing the chemistry rather than masking it with flavor. Subscribe, because the next video covers another Amish daily habit that costs nothing and handles a problem most people spend money on every month without solving it. Tell me in the comments whether you have tried anything like this before and what your dentist said, because the responses tell me which part of this to go deeper on next.